How did ancient Egyptians perform brain surgery? Over 4,000 years ago, Egyptian doctors were performing brain surgery with success rates that would challenge modern neurosurgeons. Ancient skulls found in Egyptian tombs show clear evidence of trepanation, holes drilled into living patients' heads with such precision that bone growth around the edges proves the patient survived and healed. Welcome back to Beneath the Ruins. Today, we're uncovering one of medicine's greatest mysteries. How did ancient Egyptian doctors develop neurosurgical skills that wouldn't be matched for thousands of years? The evidence suggests they possessed medical knowledge that was somehow lost to history, only to be rediscovered in the modern era. The story begins with a shocking discovery made by archaeologists examining ancient Egyptian burials. Skull after skull showed evidence of surgical procedures, clean, circular holes drilled through bone with such precision that modern doctors initially refused to believe they were ancient. But here's what makes this truly extraordinary. The bone growth around these holes proves the patients didn't just survive the surgery. They lived for months or years afterward. New bone formation around surgical sites is clear evidence that ancient Egyptian brain surgery had remarkable success rates. The most famous evidence comes from the Edwin Smith Papyrus, a medical text dating to 1600 BC that contains the world's first recorded descriptions of brain surgery. This isn't primitive folk medicine. It's a sophisticated surgical manual with detailed instructions for treating head injuries, skull fractures, and brain trauma. What's truly mind-blowing is the level of anatomical knowledge demonstrated in these texts. The papyrus describes the brain as the marrow which is in his skull, showing that Egyptians understood the brain was a soft tissue protected by the hard skull. They identified different types of head injuries and prescribed specific treatments based on the location and severity of trauma. But here's where it gets really interesting. The papyrus includes the first known description of the brain's surface, noting the gyri and sulci, the folds and grooves visible on the brain's outer layer. This kind of detailed observation could only come from direct examination of exposed brain tissue during surgery. Egyptian medical texts describe symptoms we now recognize as signs of brain injury: loss of speech, paralysis on one side of the body, and changes in behavior or personality. The fact that ancient doctors connected these symptoms to head trauma demonstrates sophisticated understanding of brain function. Archaeological evidence shows that Egyptian surgeons used specialized bronze instruments designed specifically for cranial surgery. These weren't crude tools. They were precision instruments crafted for delicate work on the human skull. Trepanation sets found in medical burials include drill bits, scrapers, and probes that show clear signs of use on bone and soft tissue. The most shocking aspect of Egyptian brain surgery is the evidence for repeat procedures. Some ancient skulls show multiple trepanation holes, with clear signs of healing between operations. This suggests not only that patients survived initial surgery, but recovered well enough to undergo additional procedures. Modern analysis of these skulls has revealed surgical techniques that weren't redeveloped until the 20th century. Egyptian surgeons knew how to angle their drilling to avoid major blood vessels, how to size their openings to provide access while preserving skull integrity, and how to create smooth edges that would heal properly. But that's not the most amazing part. Recent studies have shown that ancient Egyptian trepanation had success rates of 60 to 90%, depending on the type of procedure. These numbers are comparable to modern neurosurgery, despite being performed without anesthesia, antibiotics, or imaging technology. How did they achieve such remarkable results? The answer lies in techniques that modern doctors are still studying. Egyptian surgeons developed methods for controlling bleeding during brain surgery that relied on precise knowledge of skull anatomy and blood vessel locations. They used a technique called controlled drilling that involved making small holes around the perimeter of the area to be removed, then carefully connecting them to create a larger opening. This method minimized trauma to surrounding tissue and reduced the risk of catastrophic bleeding. Egyptian doctors also understood the importance of infection control. Medical papyri describe cleaning procedures and wound care that included honey-based antiseptics, linen bandages, and monitoring for signs of infection. Honey contains natural antibacterial compounds that modern medicine has proven effective against surgical site infections. The mystery deepens when we consider Egyptian beliefs about the brain. Traditional Egyptian religion taught that intelligence and personality resided in the heart, not the brain. During mummification, they carefully preserved the heart while discarding the brain as unimportant. Yet their surgical procedures demonstrate detailed knowledge of brain function and the consequences of different types of head trauma. This contradiction suggests that Egyptian medical practitioners had empirical knowledge that contradicted their religious beliefs, or that their understanding of brain function was more sophisticated than religious texts suggest. Here's what makes this story even more incredible. Egyptian brain surgery techniques were so advanced that when they were rediscovered in the 19th century, European doctors initially dismissed them as impossible. The idea that ancient people could perform successful neurosurgery challenged assumptions about medical progress and historical development. Recent archaeological discoveries have revealed the full extent of Egyptian surgical capabilities. Skulls have been found showing evidence of procedures to relieve pressure from brain swelling, operations to remove bone fragments from traumatic injuries, and even what appears to be surgery to treat chronic headaches. Some Egyptian skulls show evidence of experimental procedures that suggest doctors were actively investigating brain function through surgery. Different types of cuts and holes indicate they were testing various approaches to treating brain-related symptoms. The tools found in Egyptian medical burials are remarkably sophisticated. Bronze drills with different bit sizes allowed for precise control of hole diameter. Curved probes enabled doctors to examine brain tissue without causing additional damage. Specialized scrapers could smooth rough bone edges to promote healing. What's most shocking is evidence that Egyptians performed brain surgery on children. Pediatric skulls show the same careful surgical techniques adapted for smaller, more delicate bone structure. The success of these procedures demonstrates extraordinary skill, since children's skulls present unique challenges that require advanced understanding of growth and development. But here's where the story takes an incredible turn. Analysis of mummified brains has revealed that some individuals underwent brain surgery multiple times throughout their lives. These weren't emergency procedures. They appear to be planned operations performed by doctors who expected their patients to survive and live normal lives. The decline of Egyptian brain surgery knowledge represents one of history's great medical losses. When the Roman Empire conquered Egypt, much of the specialized knowledge was lost as Greek and Roman medical practices replaced traditional Egyptian techniques. Medieval European medicine wouldn't redevelop trepanation until the Renaissance, and even then, success rates remained far below what Egyptians had achieved thousands of years earlier. The sophisticated understanding of brain anatomy and surgical technique demonstrated in ancient Egypt wasn't matched again until the development of modern neurosurgery in the 20th century. Modern doctors studying ancient Egyptian surgical techniques have found applications for contemporary medicine. The controlled drilling method has been adapted for modern procedures, and Egyptian infection control practices have informed current surgical protocols. The mystery of how ancient Egyptians developed such advanced brain surgery skills continues to puzzle medical historians. Without modern imaging, anesthesia, or understanding of germ theory, they achieved surgical outcomes that rival contemporary medicine. Their success suggests a level of medical knowledge and practical experience that required centuries of development and refinement. The detailed records they left behind indicate a systematic approach to medicine that valued empirical observation and continuous improvement. Perhaps most importantly, Egyptian brain surgery demonstrates that ancient peoples were capable of scientific thinking and medical innovation that challenges our assumptions about historical progress. Their achievements remind us that knowledge can be lost as well as gained, and that human ingenuity has been solving complex problems for thousands of years. The truth is that ancient Egyptian doctors performed brain surgery with remarkable success because they combined careful observation, systematic technique, and generations of accumulated experience. Their methods prove that effective medicine doesn't always require high technology. Sometimes it just requires deep understanding of human anatomy and skilled hands. What do you think enabled ancient Egyptian doctors to achieve such remarkable surgical success? Could their techniques offer insights for modern medicine? Share your thoughts in the comments below, and subscribe for more stories of ancient knowledge that challenges our understanding of the past.